After your shoulder surgery, we'll eventually begin range of motion. This has to be done safely as the protocols allow. The first motion we'll allow you to do is called passive range of motion. That means your joints move without firing the muscles around it. Again, treating your shoulder like a wet noodle. The first motion we'll describe today is forward elevation. There's several ways to do this. At home, the first ones you'll start are table slides. For this, you can use a piece of paper on a slick table. You'll put it next to you at elbow height, and you'll slowly lean forward and allow the paper to slide around the table. You'll go ahead and push until you feel that resistance and a good stretch, but not to the point of pain. You'll hold it for 15 seconds, and you'll slowly straighten out your body and allow the elbow to come back to the side. You'll do this 3 sets, 3 times a day. In addition, if you feel comfortable and you have a wheelie chair, you can go ahead and grab the table in front of you or a desk and go ahead and do the same motion by wheeling the chair backwards. And you'll keep going just until you feel that stretch right just before the point of pain. You'll hold it for 15 seconds, and you'll do this again 3 times a day, 3 reps each. The next set of exercises we'll discuss will be with a wand. This can be with a cane or a dowel rod or something similar. You'll want to do these laying supine, as that will help support the shoulder muscles. They won't be fighting gravity. You'll lay down on the bed or the floor. You'll grab the wand about shoulder width apart, and you use the other arm to help lift the shoulder up above your head. At first, we'll usually go to about 0 to 140 degrees as to not jeopardize the repair. You'll want to hold it at that height for about 15 seconds, again, right when you feel that stretch, but before the point of pain. You go ahead and let it down, and you'll repeat this for 15-second reps, 3 times a day, sets of 3. Eventually, we'll increase 0 to unlimited forward elevation, at which point you'll be allowed to go a full 180 degrees. The next exercise we'll work on is external rotation. To do this, you'll bring the elbows directly to the side, and again you'll grab the wand shoulder width apart. For less stretch, when you're quite tight right after surgery, you can narrow your grip, and as you approach the 3-month mark or even further, if you widen your grip, you'll get more stretch. To do this appropriately, again you'll have the elbows tucked close at the side. You'll start grabbing shoulder width apart, and you use the non-operative arm to help push the operative forearm out to the side. You'll do this again for 15 seconds, 3 sets, 3 times a day. The last range of motion activity you'll be doing passively will be with a wand behind the back, working on internal rotation. To do this, you'll use your non-operative arm to lower the wand back behind you. You'll then reach behind you below your back with the operative arm. You'll grab the wand, and then your non-operative arm will simply pull up on the wand, or if it's more comfortable, you can use a towel. You'll pull again until you feel that point of resistance. You'll hold it for 15 seconds, and again you'll do 3 sets, 3 times a day. In addition, we want to work on posture and rhomboid isometrics after surgery. This ensures that you're not abnormally using the muscles around the shoulder, which could cause cramping and even compromise your outcome. 3 times a day, you'll want to do sets of 15 seconds, 8 reps of pulling the shoulders back towards themselves as if you're pinching a towel between the shoulder blades. And this will tighten up the muscles around the shoulder. In addition, you can look in a mirror and make sure you're holding yourself with symmetric posture, and that will make sure that things are nice and aligned, so when we do start strengthening and more aggressive motion, you're on pace.